with a population that's aging well over 60,000 people over the age of 60, living longer, that want to stay in their homes. But unfortunately, not everyone can stay in their homes. And if you've taken a tour of our nursing home in the past, it's actually been shameful the way the building has decayed over the years, the way the entrance is into this nursing home, and to really see how far we've come in these last 5.5 years. And to announce today, very excited to announce today, that the State Department of Health, regarding our $60 million revitalization plan, was approved. It was approved that we have to still submit our application. We have to cross our T's and dot our I's, and then we have to give them our first check, which is of $336,115 before 1 October, and the project will literally kick off by 1 October of this year and be completed in June of 2019.
As you can see, we've created a whole new front entrance that identifies as the new entry to the facility. And we've raised up a whole glass area here that brings light into the new lobby and a new porte cochere out front. And we're keeping the existing building pretty much as it was and installing new windows throughout, and it'll refresh the whole exterior of the building. The existing building, which is all in white here, are the existing wings. We are now taking all the resident rooms in the tower building and bringing them down on the first floor. So it'll be a one-story skilled nursing facility. In yellow are the additions. So we have 6 additions connecting onto the L-shaped wings. And by doing that, we have created interior courtyards on each wing.
Is the walkways in here, and it's a different garden, so people here can go to different places throughout the day. Or if you hang out here on a Monday, you can hang out there on a Tuesday, and it really gives you a sense of seeing something differently. But most importantly, it's all enclosed, so the residents can't walk away. We can monitor them, and they can hang out there with their families and have a little picnic, enjoy themselves out there during the nice weather. So it's something that we really look forward to having more done here. But I do want to say before I bring up Larry Slacky that this was no small accomplishment. It was a partnership between my office and the legislature, but mostly it was the health department that really signed off on everything, and we went through with flying colors, and I'll let Larry talk about that.
It's going to be a special place for special people, and we're looking forward to this renovation to take place. Once everyone is down on the first floor, we'll be able to improve our outcomes of quality. All of the existing rooms, which is 125 on this floor, will all now be private, so we'll have over 125 private rooms. We will have 10 country kitchens so we can serve our residents on the unit. And like I said, it's going to be a special place, progressive, quality of care, and achieve quality outcomes.
It's going to be a great asset to Albany County in the future. And it's good news, and it's a good day for the baby boomers of Albany County, because they're going to have a 5-star, first-class nursing home that's going to be available to them right here where they live.
One of the most important things that we can do as public servants and as Democrats and my members on the majority is that we look after the most vulnerable of those in society. And I think we're sending a message here that we're ready to double down on taking care of the seniors in Albany County and giving them and their families a facility that they can be proud of and we can be proud of. And hopefully this is the start of something really great here, and we can continue building on this as the years go by.
Over 5.5 years ago, we had a $19 million deficit out here at the nursing home. It was costing the taxpayers of Albany County well over $1 million a month. In a partnership, in working together, we've taken that deficit. We're down to $3.7 million. But if you notice in the middle of this nursing home, there's a tower. And once we move all the patients down to the first floor, we're going to do a mixed use of the floors here that are here left in the building. For some of our county agencies, we will move them out here. We have announced in a partnership with Sheriff Apple, we will be putting the 911 system headquartered here on top of the top floor, and a variety of other services that Larry has identified that can really help the patients here for quality of care, where we don't have to get, they have to take an ambulance ride or get a ride to a doctor's appointment or certain things. So it's going to be a mixed use that's going to generate us money. And the good thing about it is the upper floors will have their own entrance. They will not come through the nursing home. They'll have their own parking in the back. No one will see them. They'll be here. They'll be like a silent partner, which will be nice for the residents, and it won't disturb anything that's going on here at the nursing home.